Hello, congratulations on your new baby. My name is Jenna, registered nurse lactation consultant, and thank you for taking the time to learn how to establish and maintain your breast milk supply using a multi-user hospital-grade breast pump, the Medela Symphony. Breast milk is custom-made, perfect nutrition for your baby, and providing breast milk for your baby gives them perfect nutrients for optimal growth and development. It also protects against infections, even if your baby was born prematurely. Your breast milk supply is established and maintained by stimulating and emptying your breast well 8 times a day. If you have a healthy term baby that's nursing effectively, they're going to do that work for you. If your baby was born prematurely or is having trouble nursing effectively, then you'll need to use a high quality breast pump with properly fitting flanges to protect that milk supply at least 8 times a day. Using the proper size flange during your pumping is really important because that's going to provide the most comfortable pumping experience and it's going to give your pump the opportunity to be most effective. The kit for the Medela Symphony comes with a size 21 and a size 24 breast shield. The numbers are written here on the side so you can see which size is the best fit for you. When you're checking the fit, you want to make sure that your nipple is aligned in the middle of the tunnel. And as you're pumping, your nipple is going to be drawn into the tunnel. Your nipple should move freely and it should feel comfortable. If your nipple is rubbing on the inside of the tunnel, then that's too small of a fit. If your areola is being sucked into the tunnel, then that is too large of a fit. Your baby's first milk, called colostrum, is very thick and nutrient dense, and it can be difficult to express using the electric breast pump alone. So it is very helpful to add gentle breast massage and hand expression to your pumping to help your body make the most amount of milk. Gentle breast massage can be done by supporting your breast. So you want to support the underside of your breast. And then you're going to make very small circles around your breast, moving from the chest wall towards the nipple. You can also hand express to get the drop started before pumping as well as afterwards. When you're doing hand expression, you want to make sure that you're going about an inch outside of the nipple, so right around the areola generally. You want your nipple to be in line with your fingernails. You're going to hold your hand steady. You're going to gently press into your breast first, and then compress your fingers together, and then relax. Press, compress, relax. Press, compress, relax. You want to make sure that your fingers are staying steady when you're pressing into the chest. And then you'll see small drops start to form on the tip of your nipple. Now it's time to start pumping. Before you pump or handle breast milk, it's important to make sure that you're washing your hands with soap and water. If you don't have any available, then hand sanitizer works just fine. You're going to assemble all your pump parts so you have them ready to go. With this pump, you're going to push on this button to open up the top. We want to attach the caps and the tubing first. You want to make sure that the caps are nice and snug. Set them on top. And then you're going to close this door. Next, we're going to assemble the attachments. And it's going to look like this when it's all together. Assemble your pump parts. You want to start with the stem. This is a colostrum collector. This part is good for 24 hours. So you're going to attach it to the stem for the first 24 hours of pumping, and then you're going to discard the colostrum collector. The flange goes into the colostrum collector. Next, you're going to apply the yellow valve. The yellow valve has a white membrane that comes off for cleaning. There's a half moon shape that you're going to match and push it in. You want to make sure that this piece is nice and snug. This white membrane is what generates the suction. So if you have everything set up and it looks like it's right, but you're not feeling the suction as you begin pumping, make sure that that piece is in nice and snugly. The valve is going to go on facing sideways, and then the colostrum bottle goes around the valve. So now your attachments are set up. After the first 24 hours, when you discard the colostrum collector, you're going to directly attach the flange to the stem. For starting your pump session, you've already washed your hands. You've done gentle breast massage and hand express to get it started. Now it's time to attach your pump. You're going to take the tubing. There's a hole in the back here, and that's how the attachments are going to attach to the pump. You want to make sure that you're attaching both pump attachment, so you can do both breasts at the same time. And you're going to pump both breasts for 15 minutes, but not longer than 20 minutes. So you're going to power the pump on by hitting this power button. You're going to align the pump attachment so that your nipple is right in the middle, and you're going to feel the gentle pull in that stimulation or massage mode. It can be helpful to scissor hold your attachments this way so that your hands are free to do some breast massage during your pump session as well. You're going to feel this slow, gentle pull, and then you're going to adjust with this toggle button the strength of the suction to your comfort. You want it to be as strong as you can tolerate, but it should not be painful. If it hurts, turn it down. After about 2 minutes, the pump is going to automatically switch over to the expression mode. You can hear and you can feel that it's a longer, slower pull. You might need to adjust the strength of the suction again to your comfort. And again, you're going to pump both breasts at the same time for 15 minutes and not longer than 20 minutes. At the end of your 15 to 20 minute pump session, you're going to hit this power button to turn the pump off. Disconnect the tubing first. And then you're going to carefully remove the flanges from your breast, lifting up slowly and then scooping up. That way you don't lose any of those precious drops of colostrum that collect underneath your breast. You can end your pump session by going back and forth and hand expressing for 2 to 3 minutes to get any other drops that are in there, and you can collect it in your breast. After each use, take apart all of your attachments. You can use the bin provided with the attachments. You want to make sure to wash them with warm, soapy water. You want to use an unscented, non-antibacterial dish soap and lay them out to air dry after each use. Make sure you repeat this process every 3 hours, so 8 times a day to optimize your milk supply. And don't stress if you miss a pump session. You just want to make sure that you make up for it as soon as possible. After disconnecting your attachments from the tubing, if you notice condensation in the tubing, you can turn the pump on, turn the suction all the way up, and allow the pump to push that condensation out of the tubing. If your baby's in the NICU, make sure that you're pumping directly into the bottles provided by your facility or use a syringe provided by your facility to draw up your colostrum. Make sure to label it with the date and time that you pumped it and store it according to your facility's guidelines. Try not to touch the inside of the lid or the bottle to avoid contamination. Most NICUs require sterilization of all of your pieces daily, but check your facility guidelines. Try to match your pump session times with the touch times of your baby in the NICU. That way, when your baby is strong enough and able to nurse, your breasts are going to be ready to feed the baby. You can also bring all of your attachments and pump at the bedside. Also, skin-to-skin snuggles helps to increase your milk supply. Express breast milk is good at room temperature for 4 hours. It's good in the refrigerator for 4 days, and it's good in the freezer for 6 months. Keep track of your pump times and your pump volumes using a log or an app for your convenience. If you have any other questions regarding the breast pump use or your breast milk supply, reach out to the lactation consultant in your facility or a lactation consultant out in the community after discharge. Thank you for watching this video. Congratulations again on your baby.